sounds like whether or not you have a right to healthcare access is a little bit of our values as a nation being operationalized. So how does our current healthcare system operationalize those values?
Yeah, it's an excellent point. And policies in general, not just health policies, but all of our policies, all of our laws really operationalize our values. You nailed that very nicely. They operationalize our values, right? Because when we pass laws and we pass policies, we're creating rules that we are placing upon either the entire population or certain subpopulations, right? It isn't we are it is operationalizing our morals, our ethics, our values. So when we think about health policy, I mean, again, us as a nation, since the inception of this nation, we are very pro small government, right? We have a capitalistic approach. We have a free market. Free market principles are really the foundation of the way that we look at pretty much all industry in this country, and healthcare is an industry in this country. It is, and it always has been an industry in this country, and right now it's a major industry in this country. So when we think about these kind of foundational principles around small government, capitalism, free market, also individual choice, I mean, that's a huge piece here, is this idea of individual rights. And when we talk about health, it becomes really complicated because we're talking about individual rights, which is highly valued in this nation and always has been, versus the public good. And I think, right now we're living through a pandemic, and this is a living case study in all those concepts that I just mentioned, right? It is a living case study in individual rights versus public good. Masking, the conversation around masking is a case study in that. Also thinking about the role of government. Do we want big government? Do we want small government? Do we want the federal government telling us what to do? Should this belong to the states? Or should this even not even belong to the states, but belong to the localities, right? And how much government control or intrusion is the right amount? At what point do we let government in? And is it for like a very specific time versus not? And then, thinking about the capitalism piece, and right now we see this. We are trying to balance public health and the public good with also economic principles and also these individual rights principles. So in many kind of unfortunate ways, the pandemic ends up becoming, this prime case study in all of these concepts. But these concepts exist in all of the health policy concepts. There is literally not a health policy controversy that exists that is not, that is not considering all of these concepts at once. It's just the pandemic is, impacting all of us, obviously, and it's at a 1,000-foot level.